It's never surprising to me how many women get their ferritin checked and find that it is very low. I had an overwhelming response to my video about hair loss and low ferritin. So one of the main questions that came from that was, how do I raise it back up? Dietary wise, foods that are high in iron, things like your green leafy vegetables, red meats like steak. Anybody that has a ferritin level less than 20 is gonna have a really difficult time getting that up with supplements. At least that's what I find in my practice. Speaking with your clinician about the possibility of IV iron infusions can always move that up a little bit faster. Ferritin, when it's low, will give you symptoms very similar to hypothyroidism. Things that include fatigue and brain fog, joint pain. Restless leg is a really common one. Losing hair is a big sign. So IV iron can help bump that up. I like to see my ferritin level around 70 to 100. And most of my patients, that is what we strive for. And when we get into those ranges, they start to really feel a lot better. If you're not at a level where you need IV iron, then supplementation can be helpful. And there's lots of different options for raising a ferritin. And one of my favorites, and y'all, I have no brand deals. I don't know if you've noticed, but I have all of about 200 followers. So this is just what I use and what I recommend for my patients. But my personal favorite is by Thorne, and it's called Ferrisorb. This is what I like to use. And depending on how low your level is, we will use this. Maybe not quite as directed on the bottle. We may increase the amount we take or the frequency that we take them. And I always pair that with the supplement also from Thorne called vitamin C. I like to take 1,000 milligrams of vitamin C every single time that I take my Ferrisorb. Recheck the levels about every 3 months, and that can help you to make sure that what you're taking is actually beneficial to you. Ferritin can be tricky if you're taking other medications and other supplements, trying to space it correctly so that you have good absorption. And so I like to take this one with dinner. That's what I did for myself. And when I encountered my own hair loss, my ferritin was in the 30s. I used these two supplements, and within a couple of months, I was up just over 100 and obviously felt better, and my hair stopped falling out and started growing back. Definitely consult your clinician. This is not medical advice. This is just what I did. Please like, share, save this video. Type down below in the comments if you actually had a low ferritin and you were able to raise it up, and if so, what did you do?